What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. In this video today, I'm going to be talking about some tips for going back to school. August and September are months where medical students, college students, elementary, middle school students, grad students all go back to school. So it's a very exciting time, but it also can be a very nervous time frame for a lot of people. So I have been in school or in training for the last 14 to 15 years. That is 4 years of college, which it actually took me 7 years due to me being in the military on active duty. I did a 1-year post-bac program before med school, 4 years of medical school, 5 years of surgery training, and in my last year of training, spine fellowship. So I know all about going back to school and what it entails, and in this video today we're going to be talking about some tips for you guys. So what are some tips for you guys that are going back to school here in the next week, or maybe already started to go back? So I think the first thing, number one, is to start off strong, especially if you are going from high school to college, where that transition may be a rough transition. Or if you're going from college to medical school, that may be a more difficult transition. So the most important thing I would think is to start off strong. Some people would say it's hard to catch up. So if you are struggling the first couple of classes or the first semester of med school or grad school, it may be difficult to catch up. And for a lot of people, this transition can be a rough one or a difficult transition just because you're not used to the pace. In college, we used to take 12 to 15 hours of semester credit hours, and that was considered full time. But when you get in medical school, you're taking 35 to 40 credit hours per semester. So it's a lot of information in a short amount of time. I suggest that you do whatever you can do to start off strong. And you can do this with my second tip. My second tip is to develop a routine. In college, as well as in medical school, every first couple weeks of the new semester, I would try to get into a routine. And this was a routine of waking up, routine of when I would study, a routine of where I would study, and who I would study with. Some people study better alone, and other people study in groups. I kind of had a combination of this over the years. In medical school, I would study by myself and then come together with some classmates to make sure we understood the information. We would go through the information together as a group and did practice questions together. And I thought this was effective for me. So not everyone works like this, and find out how you learn and you study best. Also, the routine for, say for instance, for fellowship. The transition from residency to fellowship, I had a gap in time between the end date of residency and the start date of fellowship. So there was a couple weeks where I was just sitting at home after I had took my boards and really nothing to do. When fellowship started, I had to be to work pretty early, sometimes 5 o'clock in the morning, 5:30, 6 o'clock in the morning to do surgery, see my patients, do research. So I'm starting to get into a routine as well. And in terms of a time routine, I make sure that I am up at the same time every day at 5 a.m. So there's really no question about it when it's time to get up in the morning to see what time I need to be to work, because I already know I need to wake up at 5 a.m. Find out what works best for you in terms of a time, schedule, when you'll incorporate a workout, who you will study with, where you will study, and that's my second tip for you guys. My third tip is to develop some type of system where you have some balance. Work-life balance or work-life harmony. I have another video about that and I'll put it right up here. But it's a hot topic these days where there's burnout in the field of medicine. There's different surgeons, different groups of specialties that have higher burnout rates than others. And I think it's important to develop these skills kind of earlier on in your first couple years of college, medical school. So when you get your residency and as well as fellowship or even attending, you have some system in place that you can utilize. Find something outside of medicine that intrigues you, that you have a passion for, that you can turn to when you're stressed out or you need to get away or you need to step away from the books. And for me, it's traveling. I like to work out. I like to make videos for you guys. So find something that's important for you. Family support, it's always helpful. Going through the years and going through the different classes that you'll take, it's important to have some type of support system. So those are my 3 tips for all of you out there that are starting back school. I think it's important to start off strong. I think it's important to develop a routine as well as find some type of balance, things that you can do outside of your normal studying, outside of medicine, that will help you have some type of harmony when it comes to work, life, and maybe school. This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.